Today, we're diving into a topic that's often misunderstood: Narcissistic Personality Disorder, or NPD. While the term narcissist is used casually in everyday conversation, the clinical reality is much more complex. NPD is not simply about being self-centered or vain. It's a recognized mental health condition with deep-rooted patterns and significant impacts on individuals and those around them. In this video, we'll explore what NPD truly means, how it manifests, its causes, and the effects it can have on relationships. By the end, you'll have a clearer, more compassionate understanding of this often misunderstood disorder. Narcissistic personality disorder is a mental health condition characterized by a long-term pattern of exaggerated self-importance, a deep need for admiration, and difficulty empathizing with others. People with NPD often appear confident and self-assured, but beneath the surface, they may struggle with fragile self-esteem and be highly sensitive to criticism. This contrast between outward confidence and inner vulnerability is a key aspect of NPD. Understanding this duality helps us see that NPD is more than just arrogance. It's a complex psychological struggle that affects how individuals relate to themselves and others. On the surface, individuals with NPD may seem self-assured, even charismatic. However, their outward behavior often masks a deep sense of insecurity. This internal struggle can make them highly sensitive to criticism or perceived slights. They may react defensively or even aggressively when their self-image is threatened. Recognizing this gap between appearance and reality is crucial for understanding why people with NPD behave the way they do. It also helps us approach the topic with empathy rather than judgment. NPD presents with a range of symptoms that go beyond occasional self-centeredness. These include a grandiose sense of self-importance, preoccupation with fantasies of unlimited success, power, beauty, or ideal love, and a belief that they are special and can only be understood by other high-status people. People with NPD often have a strong sense of entitlement, may exploit others in relationships, and show little empathy. They might envy others or believe others envy them, and often display arrogant or dismissive attitudes. One of the hallmark features of NPD is grandiosity, a belief in one's own superiority and uniqueness. This isn't just confidence. It's an inflated sense of self that can lead to unrealistic expectations from others. People with NPD may expect special treatment and become frustrated or angry when they don't receive it. This grandiosity often masks underlying feelings of inadequacy, making it difficult for them to accept criticism or setbacks. People with NPD are often preoccupied with fantasies of unlimited success, power, brilliance, beauty, or ideal love. These fantasies can dominate their thoughts and influence their decisions. They may constantly seek validation or admiration to reinforce these fantasies, sometimes at the expense of real-world relationships and responsibilities. This preoccupation can make it hard for them to engage authentically with others. Another common symptom is the belief that one is special and can only be understood by, or should associate with, other special or high-status people. This can lead to social isolation or a sense of superiority over others. It also makes it difficult for people with NPD to form genuine, equal relationships, as they may dismiss those they perceive as ordinary. A strong sense of entitlement is another key feature of NPD. Individuals may expect others to cater to their needs without question. This entitlement can lead to exploitative behavior, where the needs and feelings of others are overlooked or dismissed. Such patterns can create significant strain in personal and professional relationships. Low empathy is a defining characteristic of NPD. People with this disorder often struggle to recognize or care about the feelings and needs of others. This lack of empathy can make it difficult for them to maintain healthy, supportive relationships. It can also contribute to misunderstandings and conflicts, as others may feel ignored or devalued. Envy is another symptom of NPD. Individuals may feel envious of others' achievements or believe that others are envious of them. This can fuel feelings of resentment or superiority. Arrogant or dismissive attitudes often accompany these feelings, further isolating the individual from meaningful connections. It's important to remember that everyone can display narcissistic traits from time to time. NPD is diagnosed only when these traits are persistent, inflexible, and cause significant problems in daily life or relationships. The distinction lies in the frequency, intensity, and impact of these behaviors. Understanding this helps prevent mislabeling and encourages a more nuanced view of the disorder. Diagnosing NPD involves a thorough psychological evaluation by a qualified mental health professional. The process includes assessing the individual's thoughts, feelings, and behaviors over time. Clinicians look for persistent patterns that match the diagnostic criteria outlined in the DSM-5, the standard manual for mental health disorders. Accurate diagnosis is essential for effective treatment and support. There isn't a single cause for NPD. Research suggests that a combination of genetic, environmental, and psychological factors contribute to its development. Genetics may play a role, as personality traits can be inherited. Early childhood experiences, such as excessive praise or severe criticism, can also influence the formation of narcissistic traits. Family and social dynamics further shape how these traits develop over time. Genetics can influence the likelihood of developing NPD. Studies suggest that certain personality traits, such as sensitivity to criticism or a tendency toward grandiosity, may be inherited. However, genetics alone do not determine whether someone will develop NPD. It's the interplay between genes and environment that shapes personality. Early childhood experiences play a significant role in the development of NPD. Excessive praise, overindulgence, or, conversely, severe criticism and neglect can all contribute. These experiences shape how children view themselves and relate to others, potentially fostering narcissistic traits that persist into adulthood. The environment in which a person grows up also matters. Family dynamics, cultural values, and social influences can all contribute to the development of NPD. For example, environments that reward superficial achievements or discourage emotional expression may increase vulnerability to narcissistic traits. It's important to emphasize that no single factor guarantees the development of NPD. Instead, it's the combination of genetics, early experiences, and environment that increases vulnerability. This complexity highlights the need for a nuanced understanding of the disorder, rather than oversimplified explanations. NPD can deeply impact all types of relationships: romantic, professional, and familial. Individuals with NPD may seek constant admiration, avoid accountability, or struggle to recognize others' feelings. These patterns can create cycles of conflict, misunderstanding, and emotional distance, making it challenging to maintain healthy connections. In romantic relationships, NPD can manifest as a need for constant attention and admiration. Partners may feel unappreciated or emotionally neglected. The person with NPD may struggle to accept responsibility for problems, leading to repeated conflicts and a lack of genuine intimacy. In the workplace, Individuals with NPD may seek admiration from colleagues or superiors and may react poorly to feedback. They might take credit for others' work or avoid accountability for mistakes. These behaviors can create tension and undermine teamwork. Within families, NPD can lead to strained relationships and emotional distance. Family members may feel manipulated or undervalued. The individual with NPD may have difficulty recognizing the needs and feelings of others, which can cause ongoing conflict and hurt. The patterns associated with NPD often lead to cycles of conflict and misunderstanding. Attempts to address issues may be met with defensiveness or blame shifting. Over time, these cycles can erode trust and intimacy, making it difficult to repair relationships. Emotional distance is a common outcome in relationships affected by NPD. The lack of empathy and difficulty with emotional intimacy can leave partners, friends, or family members feeling isolated and unsupported. This distance often reinforces the cycle of conflict and misunderstanding. A core feature of NPD is the need for admiration. Individuals may go to great lengths to receive praise or attention, sometimes at the expense of others. This constant need can be exhausting for those around them and may lead to resentment or withdrawal. People with NPD may avoid taking responsibility for their actions. When confronted with problems, they might deflect blame or minimize their role. This avoidance can prevent resolution and contribute to ongoing issues within relationships. Difficulty empathizing with others is a persistent challenge for those with NPD. They may not recognize or validate the emotions of those around them, leading to feelings of neglect or frustration in their relationships. This struggle can make it hard to build mutual understanding and support. Misunderstandings are common in relationships involving NPD. The disconnect between the individual's self-perception and others' experiences can lead to confusion and frustration. Open communication is often difficult, as attempts to address issues may be met with defensiveness or denial. The emotional impact of NPD on loved ones can be significant. Partners, friends, or family members may experience feelings of rejection, inadequacy, or chronic stress. Understanding these effects is important for providing support and seeking help when needed. The good news is that NPD can be treated. While change can be challenging, especially given the nature of the disorder, therapy and support can make a significant difference. Treatment focuses on helping individuals develop healthier self-esteem, improve empathy, and build more satisfying relationships. Therapy is the primary treatment for NPD. Psychotherapy, particularly cognitive behavioral therapy, can help individuals recognize unhealthy patterns, develop greater self-awareness, and learn new ways of relating to others. Progress may be gradual, but with commitment, meaningful change is possible. The main goals of treatment for NPD are to help individuals build healthier self-esteem, increase empathy, and improve their relationships. Therapy can also address co-occurring issues, such as depression or anxiety, which are common among people with NPD. Treating NPD can be challenging. Individuals may resist acknowledging their difficulties or may not see the need for change. Building trust and motivation is a key part of the therapeutic process. Patience and persistence are essential for both the individual and the therapist. Support from family, friends, and mental health professionals can make a significant difference in the treatment process. Encouragement, understanding, and clear boundaries help create a safe environment for growth and change. While there is no medication specifically for NPD, medications may be prescribed to address symptoms like depression or anxiety that often occur alongside the disorder. Medication can be a helpful part of a comprehensive treatment plan, but therapy remains the cornerstone. With the right support and treatment, individuals with NPD can make meaningful progress. Change may be slow, but improvements in self-awareness, empathy, and relationships are possible. Hope and persistence are important for both individuals and their loved ones. If you have a loved one with NPD, it's important to set healthy boundaries and seek support for yourself as well. Education, counseling, and support groups can provide valuable resources and coping strategies. Remember, you are not alone in facing these challenges. Caring for someone with NPD can be emotionally draining. It's essential to prioritize your own well-being. This might include seeking therapy, practicing self-care, and connecting with others who understand your experience. Taking care of yourself enables you to offer better support. Healthy boundaries are crucial when dealing with NPD. Clearly communicating your needs and limits can help protect your emotional health. Boundaries also provide structure and clarity in relationships, reducing the risk of manipulation or burnout. If you or someone you know is struggling with NPD, seeking professional help is an important step. Mental health professionals can provide diagnosis, treatment, and ongoing support. Early intervention can make a significant difference in outcomes. There is often stigma and misunderstanding surrounding NPD. Education and open conversation can help break down these barriers. By increasing awareness, we can foster greater compassion and support for those affected by the disorder. Many myths surround NPD, such as the belief that all narcissists are simply selfish or that they cannot change. In reality, NPD is a complex mental health condition, and with the right support, individuals can make meaningful progress. Dispelling myths helps create a more accurate and empathetic understanding. NPD can affect people from all walks of life. It's not limited to any specific gender, age, or background. Recognizing the signs and understanding the disorder can help us respond with empathy and support, rather than judgment or exclusion. Empathy is key when discussing NPD. By understanding the challenges faced by those with the disorder, we can offer more effective support and reduce stigma. Empathy also helps us build stronger, more compassionate communities. Narcissistic personality disorder is a complex mental health condition that affects individuals and those around them. Understanding its symptoms, causes, and impact on relationships is the first step toward compassion and effective support. With the right treatment and understanding, positive change is possible. Thank you for joining us on this journey to better understand narcissistic personality disorder. Remember, compassion and knowledge are powerful tools in supporting those affected by NPD. By staying informed and empathetic, we can make a difference in the lives of individuals and their loved ones.